All right, welcome everyone. Thanks for joining us today. We are going to talk about an interesting topic. Well, I think it's interesting because it relates to just about everything we do in clinical practice. All of the presentations that walk in the door, especially if you're working in a musculoskeletal type setting, pretty much everyone that walks in the door has got some kind of presentation that relates to tissue capacity. So when we're talking about tissue capacity, we're talking about the ability for various different tissues of the body to withstand stress and load, and then be able to manage that stress and load and not get injured. Bo, what's your initial thoughts around this, and what do we need to know about tissue capacity?
Well, I think first of all, we've got to understand that different tissues in our body. We've got muscle, bone, ligament, connective tissue, neural structures, joint capsules. So there's various different tissues in our body that will respond to different amounts of load. And when you think about a lot of the times that load just gets, or pain or injuries tend to look at just the muscular component. So I think that's interesting, first of all, that we need to understand the different types of tissue and how they will individually respond to different amounts of load. So I think that's a good place to start. Often when people come into clinical practice, we tend to focus a lot on the muscular component. And when we look at load, we've got overload, we've got underload. And typically when someone comes in, it's usually because I've been doing something which has caused me to feel this type of symptom. And so appreciating that, I think, is key to start with. And when we look at load modification, certain tissues may be overloaded or underloaded. And then when we apply a certain amount of load or a dosage of load to that particular tissue, that could quite easily lead to overload. So I think it's really important to understand the current capacity of the person in front of you, and then, working with that.
Yeah, and I think that's a good point you made there about someone walks in the door into clinical practice and says, I've got this pain because I've been doing this thing. That's directly related to the tissue capacity for that person. Someone will come in and say, my neck and shoulders are killing me. On the weekend, I was painting the ceiling, the roller brush, and now my neck and shoulders are killing me. And you go, right, it's because of that action. Obviously it's arms overhead for all that time has made your shoulder sore, but there are tens of thousands of painters around our country every day painting ceilings with roller brushes. And I can guarantee not all of them are coming with the same problem because they've developed tissue capacity to deal with that. And so we often, I think, jump to this conclusion and say, well, this movement pattern, this posture, this positioning of your body is the cause of the pain. But really, it's not the movement. The action, the physical activity is not the problem. It's your body's ability to undertake that movement, that physical activity, and withstand that load.
Yeah, it's quite simple when we look at it that way. Is too much too soon? What's your previous exercise history? Have you gradually built up to be able to withstand that type of exercise or load placed on that tissue? And there's various different factors that come into that. It could be their exercise history, their age, genetic factors, hormonal factors, previous injury, level of stress, level of sleep, all of these factors that can contribute to someone being overloaded. If we're applying a stimulus and they're not having adequate time to recover and adapt to that stimulus, then quite easily that can lead to overload. Whereas if we're applying a stimulus that we have an adequate period of recovery, sleep, range of different other factors, nutrition, that we allow that progressive overload and adaptation. So our body will respond to that given stimulus.
Anyone that's ever walked into a gym will know this, right, firsthand, but we don't always equate what happens in an exercise setting with what happens in our real life, when essentially it's the same thing, just different levels of intensity.
Yeah, that's right. You go to a gym the first day, you're all keen to get in there and give it a go, and then you can't move for a week, and then you think, that was way too painful, I'm not going back to the gym, because it's just too much too soon. Whereas if you start with very small dosage, and then, have adequate rest, allow a day or two, and go back and that little bit more. So that's progressive overload. And that is the same when we look at just general presentations that come in with your non-specific low back pain, that we say, well, it's because you're sitting. Well, sitting's not the worst thing in the world. It's a part of our life, but we've got to be adapted and conditioned to be able to withstand the period that we sit down for, and that comes back to a tissue capacity. Because if you've got a deconditioned part of your body, and then you're progressively applying a stimulus to it that's leading to more decondition or even less loading, then you'll progressively respond and adapt to that. So that can really, you can see how that can lead to sensitization, that deconditioning, that sort of this pain cycle that patients can tend to go through.
Yeah, and that probably brings us to a hot topic that comes up in discussion, which is posture, right? Now, posture is one of those things that our opinions on posture and its importance in its role in generating and precipitating pain has changed. Our opinions changed over time, because it used to be we have to work on our posture. I've met therapists who that all they focus on is improving people's posture, and now we understand that the whole concept is flawed, right? Because everybody holds different positions in their body. Not everyone has pain, though, if they move out of that range. And so, but at the same time, you'll have, a client walk in the door and they'll say, look, every time I go and do gardening and I'm kind of bent over on my knees over the garden, I wake up the next day and my back's killing me. Another person comes in and says, I spend my entire day in the veggie garden, bent over, hunching over the garden, and I get up the next day and I feel great. That's my form of exercise, right? So it's not the movement, it's not the posture that's the problem. It's, like we're saying, it's the tissue capacity. And so what's the thing then? How do we get somebody who's incapable of doing that position, holding that position for periods of time, to make them capable of it? Do we just say, look, just tough it out, push through the pain, or is there another way, do you think?
Oh, do you know, it's a really good point. And I'm sort of thinking along the lines of, back to that gym example. If you held a weight, let's say you sit down for 8 hours a day and you've got shoulder pain. Well, if you did the same thing, you held a weight for 8 hours a day, and then you didn't give yourself enough time to recover. You had stress associated with work, you had lifestyle factors that were associated, poor nutritional factors. You would get to a point where that tissue is becoming overloaded. All right, then you start to have more sensitization, increase in these inflammatory chemicals. So you're not having the appropriate recovery. Now, it might sound counterintuitive to think, well, if you're having pain from muscular-based pain, tissue-based pain from sitting or doing a certain activity, it sounds sort of counterintuitive to say, well, we need to actually put more load through it and exercise it. Well, I think, we need to look at applying a stimulus with providing adequate recovery to counteract what they're doing, or allow that tissue to now be able to withstand the load that's being placed upon it.
Yeah, you're right. So it's a gradual exposure type thing. I use myself as a bit of a case study in this, and I think it's a good example to be able to give to patients as well. So as you may know, I've had some low back pain over the last few years that I've been able to manage at times and not at other times. And we were having discussion about this a while ago, and you said, what sort of movements hurt? And I said, well, deadlifts hurt. Like I hadn't been going to the gym for quite a while, but I remember when I was going, and now that I've started again, the deadlift movement, if I was to do that movement, I'm pretty much guarantee the next day I'm really sore. Sometimes midway through the exercise, it just comes on. And that was the triggering movement for me. And in that sort of self-exploration, and this is what we can do with our patients too, I realized that, well, I do the deadlift movement 1,000 times a day when I pick up something off the floor, bend down and pat the dog. It's not the movement, it's the problem. I was sensitized to that movement in that setting, and the load was probably the issue. I'm not bending over to pick up a 50-kilo dog, but I might bend over to pick up a 50-kilo barbell or something, for example. So my own approach to that was, well, let's go to the gym and let's do some very, very light deadlifts, just the bar. Let's add some really light weights. And just progressively, each second or third time I go, I'll do that movement again. But at no point in the exercise do I want to get to the point where I'm really exerting myself or to the point where I get pain. And then with the success of that, repeated over time, I can add a little bit more load, a little bit more load. And just yesterday I was in there and I was adding quite a lot more load, but again, not pushing to the point of pain, because I want to trigger again that painful experience, not just for the physical reason, but for the psychological reason. You know, we've talked before in other discussions around how people get sensitized. They develop these kind of, we call neurotags, where certain movements, situations, environments, activities, feelings, thoughts, smells, anything can trigger you back into a pain cycle. And so avoiding that pain experience, making sure that you're successful, positive, and you have a good experience doing something, and then gradually just add more and more over time. Never really exploring the red line on the tacho, but just kind of staying in that comfortable rev range. And then you'll find that that red line gets moved further and further away. And I think that's the trick. And the challenge we have as manual therapists working physically with bodies is that all of the modalities that we do, well, none of the, another way to say it, pretty much none of the modalities that we use in clinical practice facilitate greater tissue capacity. But our job is to put them in positions where they can challenge the tissue capacity. Our job is to give them the ability to get to that point, to give them green lights so they can just kind of keep moving forward and feel confident and safe, and their tissue feels healthy and well, and they feel ready to do things so that they can challenge themselves in greater ways. And I think that that's the greatest limiting factor of a really good manual therapist, is that they never steer their practice, steer their patient towards that kind of activity. They want to keep them wrapped up in bubble wrap and say, let me treat you, let me be the solution to your problem. And then the patient goes back out into the real world, goes to bend over and pick up something. The tissue's no better than it was. They feel better in the moment, but its capacity hasn't increased. Yeah.
Yeah, I really like those points. And you got to think about it as these small steps. Nowadays in society, we all want the quick fixes. We want something to fix it straight away without putting in the work. And I think that's such a challenge when we look at exercise compliance and engagement, is, that these things do take time. It will take some commitment and a little bit of dedication. You don't need to be in the gym every single day of the week, and there's different ways that we can exercise, but it is small steps, and it does need to be progressive, and it's really working to sort of push us to that point where we can reach our limits to stimulate an overload response. So that's progressive overload, which stimulates what's called supercompensation. So body compensates by being that little bit stronger. And if we think about this from a physiological point of view, when you've got a tissue that's deconditioned, you're going to have less motor input through that area. So when you go to the gym, you think about, you've got a minimum, 4 to 6 week period where you're gonna need to be consistent to get some good changes, because we can see significant strength gains in that period due to increased motor input to that area, not necessarily muscle size, but we get more motor input, which increases the strength of that tissue. All right. When we get the strength there, then we can start to look at increasing the frequency of exercise, increasing the amount of load placed on that tissue. So it is quite a long period thing. It's not that you just need to do these exercises for the next 2 weeks and you'll be good to go. And I really like that point there about, a lot of manual therapy, we're not increasing that tissue capacity. We're reducing those inhibitions to exercise. We're improving mobility. We're decreasing the pain in that area to allow the loading of that tissue.
Yeah, that's right. And you've got to put those two things hand in hand, right? We can't just have this manual therapy approach to reducing pain, improving facilitation of exercise and activity, without then giving the body a chance to go and do it. It's like building a V8 engine in a race car, but never taking it for a drive. Like revving it in the shop and just having it running and go, well, it looks amazing, it feels great to drive, feels great to sit in, but never actually taking it for a spin. We've got to take the body out, we've got to load it up, we've got to give it a chance to develop and adapt to different scenarios. And I think that's a good message for anyone listening to this, is if you're a health practitioner dealing with that musculoskeletal, neuromusculoskeletal type pain, really work towards getting the patient in a situation where they're going to be challenged. Because what's the point otherwise, right? We can take their pain away, but we've got to give them a chance to use that ability.
Yeah, challenging is key. And I want to sort of go back to what you mentioned before about the posture and your back pain. If we're saying that, well, if that movement hurts, then don't do that movement, or don't sit that way, you need to sit like this because we don't want to make that pain worse. Well, we actually do want them to do that movement. We want to get them to that. Someone's got pain bending forward. We want to get them bending forward. We need that. That should be our goal. And we just need a strategy to load that tissue in a way that progressively gets them to that point. I want to reach up overhead or hang the clothes on the line. Well, we don't say that don't reach overhead. Let's get you more comfortable with that movement. Let's strengthen that tissue. Let's strengthen that movement. Let's improve your confidence with that movement, so that that all of those tissues start to improve their strength. So yeah, and challenging different positions. So if we told someone that you've got to sit up in this posture all day, well, yeah, it's fatiguing, and that could potentially lead to a little bit of overload and soreness early on. But it's about adapting positions, allowing them to sit in multiple positions, because our body should be able to respond to various different positions. We should be able to bend down and rotate and pick something up. I think the whole narrative around this perfect posture and perfect lifting techniques is sort of being pushed aside. When you think of your OH&S training, don't lift anything above 5 kilos, make sure you've got a straight back when you bend. We should be able to move in various different positions. And I think it's important to encourage the variation. It'd be like anything. If we do one thing for too long, potentially that could lead to some overload. But if we do multiple things in different positions, we're strengthening ourselves. We're making the patient more resilient in different positions.
That's right. And for anyone who's listening to this and thinks, well, that doesn't necessarily hold true for someone who's in a gym and trying to squat with hundreds of kilos on their shoulders. Well, okay, if you're playing at the very extreme ends of any example, there's going to be exceptions to that rule. Like if someone's trying to lift as heavy as possible in a gym, then it makes sense to put the spine in a more optimal position, to have the hips and knees in a more optimal position, over the feet and so on. Some people will be able to get away with blurring that perfect line a little bit more than others because they've developed tissue capacity for it. But for the person who's just building up quite quickly in their load, if you want to really load somebody's body up for any purpose, not just in the gym setting, then ideal posture or positioning makes sense in that early stage, especially. Or if you're at an Olympic weightlifting level, highest world level, whatever, then absolutely, hundreds of kilos on your body, perfect spine position, perfect squat position, all that technique stuff is important. But for day-to-day activities, like your examples of posture, how you sit in the chair, how you sit at a computer, how you drive a car, how you stand at the kitchen bench, whatever it might be, then we need to be more adaptable. If you just try to do everything two-dimensionally or, in a perfect, ideal way, then you don't really develop the breadth of capacity that you want to get for normal everyday function.
Yeah, and look, I know that I used to be very, you've got to sit in a certain posture, but, I think that adds more fear and more threat to the patient as well. If they're feeling a little bit of tightness or pain or whatever it may be when they're sitting, just move, just find a different position, slump for a while.
Yeah.
Bend forward, sit in the worst posture that you can find. If you have to, sit off to the side, whatever it may be, change your position. It'd be no different to say, if you were walking all day or running all day, well, you're probably going to get sore from doing too much of that. So it's just about changing that activity, changing that position, changing that movement. I think that's really important.
Yeah, and look, you mentioned right at the start, every tissue has the ability to change its capacity with load. And, we can see that absolutely in muscles, and we see that muscles develop greater motor unit activation. So we can see a very rapid increase in strength within a couple of sessions in some cases. We now know that tendon loading is the best way to manage both pain and injury or dysfunction of tendons. The tendon loading protocols that we saw come out a number of years ago are brilliant. It's the best way to do it. Ligaments respond to stress. The more axial loading, compression and stretch and stress forces you can get across ligaments, the greater they and more dense they become, so that you're stronger. In the same way that if you load ligaments, you develop proprioceptivity. So you're developing the activation of those mechanoreceptors that sense where you are and can help you control movement. So it's not just about making the tissue stronger, it's that neurological part as well that helps those tissues be supported by other structures. And then with the one we often forget about is bones. And we think, well, your bones are your bones. What can you do to change that? They're massively impacted by stress and load. Axial compressive type loading through bones is the best way to strengthen your bones. It's why we get the oldies doing, weight-bearing exercise, because that combined with a good nutritional input is the cure for osteoporosis. It's the solution. And it goes for us as well. If you've got a child, prepubescent child, and you get them doing a lot of physical impact type activities, running, jumping, that kind of thing, not only do their bones develop strength much earlier, but their tendons develop the great injury resistance. This has been shown in research that if you can get your kids active early, the chance of them getting tendon injuries later in life is dramatically reduced. So it's not just a tissue thing, it's a stage of life thing. We need to load tissues to develop capacity. And everyone will experience this at some point. They've been sick, unwell, they've had an injury, for whatever reason, they've been laid up on the couch, or in bed for a number of days. You get out of bed, not only are you stiff and sore, you just kind of feel weak, and very quickly does your tissue capacity drop off when it stops being loaded. You sit in a car for a week on a long trip, you'll feel like you just don't have as much control and ability. So we've got to keep pushing our bodies for that to change. And there's no amount of massage, there's no amount of dry needling or other manual therapy that will solve that problem for people. If they've got pain, those things are really useful. But as soon as they're out of pain, they should be starting to challenge their body.
Yeah, some great points there. And, all tissues are going to respond to load. You think about how you load a sprained ankle or a torn hamstring. It's exercise based. And I know many of you have probably heard this example that I like to give around back pain and thinking of that tissue as being unhealthy tissue, because it may be the muscle, but it may be the connective tissue through there. The fascia is highly innervated, ligamentous structures, the annulus, the disc is all innervated. And we think about pain, it's detected by those sensory nociceptors, all right? So if we've got an area that we're not moving and it's being deconditioned, well, the pH in that tissue can drop. Okay, so that can start to sensitize those nociceptors. We've got more limited amount of blood flow and oxygen supply and good nutrients into that area. So what's the best way to improve the health of the tissue is to move it, to exercise it, to get more blood through that area, which can then strengthen it, which can change the reporting back to the central nervous system, as you mentioned with those proprioceptors. That change in reporting to the central nervous system can change the output and have a change in tone, and that overall sensitization through the area. So I think that's really, really important to consider as well.
Good one, yeah. And this, I guess, something probably we could wrap up on, which is the fascial tissue, which often gets left out of this whole loading picture. We think it makes sense to load bones and muscles and tendons and ligaments, but this connective tissue, which is kind of, it's omnipotent, it's everywhere in our body, right? Fascia organizes itself along lines of stress. And so the more variety in movement that we create, the more load that we put through our body, the more that fascia will adapt to that. It will adapt to support our musculoskeletal system in those functions. It's the links in the chain, right? The fascia is the stuff that makes everything else kind of work well. And so through all of that innovation, through all of that blood supply, and through fascia's unique ability to adapt to stress, it creates almost the infrastructure for everything else to sit in and work in effectively. And so that's even more reason why variability in movement and load is so important. Bo, we've covered a fair bit there.
Yeah.
Anything else you want to throw in before we wrap it up?
No, I think that'll do for now.
That'll do for now. All right, very good. Thanks, guys. Hope you enjoyed that. Hope you took something away from it, and we'll talk again soon.